Two of the founding organizers, and fortunately for all of us, speakers at this year's symposium, are a repeat from Dr. Victor Avis and his daughter, Sydney Avis. Any of you that have heard them speak before or have heard Sydney's story do not want to miss the updated version. The Airway Revolution documentary will be coming out soon, definitely in 2024. We're hoping the first quarter of 2024, if not second quarter for sure. And the story continues to evolve, and there's so much more depth to Airway than there was, even when we began the Airway Revolution Foundation. And I was fortunately asked to be on the board as a founding member. That might have been 2 years ago. Has it been 3, Lora? I don't remember. Maybe it's been 3. But look how much has changed. There continues to be so many new solutions, so much greater understanding to the complexity of the problem, but yet more simple solutions, strategies to try, better diagnostics. That category could be a 2-day symposium in and of itself. But I wanted to make sure everyone knows that we will definitely highlight Dr. Avis and Sydney because their message is so important, and because the message and topic of Airway, as all of us that are even considering coming are well aware of, that I would say Airway concerns the oral microbiome, and those two things leading to leaky everything, leaky syndrome, are the two top contributors for heart attack and stroke risk, or why somebody's had a heart attack or a stroke or is experiencing dementia or vascular related issues in my practice. And how many years did I practice, Lora, without even really doing an adequate look at those things? Forever not collaborating with dentists and not looking at the oral microbiome. Forever. It had to be a glaring, see it with your own eyes like blood gushing out or something to consider that, oh, maybe that has something to do with a heart attack. But now we know nothing could be further from the truth. These things are hiding. Literally, it seems like a dramatic word, but they're lurking in the mouth, in the throat, in the airway, in the GI tract. I just use that collectively to talk about all of these contributors. Yes, pathogens are one of the things. But anyway, I just wanted to stop on this topic for a little bit, Lora. I know you have a lot to say about it as well. That number one, it's going to be exciting to hear an update about the Airway Revolution Foundation and to hear the updated, ever-evolving story of just Airway. I mean, Victor Avis and Sydney Avis don't even want it to be about Sydney's story anymore, because they've now gotten so many people reaching out to the foundation about their own stories that it's taken on a life of its own, which is, of course, what they wanted from the beginning, because there are millions of people out there that are suffering from ADHD and social isolation and losing their job and cancer and dementia, and the list goes on because of airway issues closely tied to oral health issues. All of that is which came first, the chicken or the egg, or they come at the same time? I don't know. But either way, that's going to be, all of that will be highlighted at the symposium. So if you thought this wasn't for you because you're not a periodontist, or because you're not a general dentist, or because you're in general practice, or whatever your reasoning is, Airway affects everyone from birth, prenatal actually, from preconception counseling actually, all the way through a person's entire life. So if you see patients at all for any reason, there are many reasons to come to the symposium, but I wanted to pause on that one for a minute. Lora, tell us your thoughts.
Yeah, I think that's what's so unique about the Airway Revolution, is that it really hits home on this fundamental problem of breathing. We say airway, but it's truly, like you said, from inception all the way through to death, we take our last breath. And so I think just following that story really just hits home that the stories in all of us, whether you're a mom and thinking of your child, or a grandparent, or taking care of your parent, and watching these things happen. I think we see it throughout that. And that's why the story is so important, is that's this universal problem. And then realizing, hey, there's so much hope. There's so much hope through the story that there are solutions out there, and we're going to be having those solutions and those strategies and being able to share with each other, where is this evolving? Where is the future, so that we can help one another and really help these patients. So I find it very moving and exciting, and just how it all ties together. You mentioned Dr. Nathan Bryan's going to be coming back and sharing his updates, and that has everything to do with airway and breathing too, our whole nitric oxide pathway, and just, again, how we can help you connect the dots in this totality of care. One of my other repeats that will be there is Ann Rice, and she'll be talking about brain health. And so again, airway, brain health, right? Everything that we're talking about here, but it's really what we want you to take away is like, what are you going to take away? Well, you're going to take away the tools to actually implement it on your patients and in your practice. And I think that's the difference, is that you're going to come away with practical strategies that you can implement right away, and that your team, when coming together, I always say, we really have 3 ways to implement in a practice. And the first way is mindset. And that's really just hearing the story from Airway Revolution and understanding how universal it is in our population. I feel like it just really shifts our mindset. I say we look at our patients through a different pair of glasses, through a different lens. We start to see our patient differently. And then from mindset, once we kind of understand that and realize these problems that is really universal in so many patients, it kind of shifts to, I say, our skill set. So our skill set starts to change. And that's the power of implementation, is really, okay, I'm going to take on some of these new skills. I get to network with the people and everybody who's there, all of our sponsors that will be there, they're helping provide these new skill sets that you get to take home. And all the people that we've really partnered with really lock arms with you and hold your hand through the process is what we need when we're getting a new skill set. And I say that builds our tool set, right? Because then I have this tool set to say, oh, this is when I use this. This is how I use this. And that becomes so important. So I hope that you hear a little piece of how different the symposium is, from networking to the speakers to the strategies, but really the biggest thing is the impact it makes on your practice. It really sets you apart. I know that that is a big piece in business and what we have to offer patients. I got, my story is always just so worn out. I was just so worn out. And if I can just give a little passion, a little hope, help one person every day by Jen Gottlieb, is like, hey, that makes all the difference to go back to practice renewed, refilled, and re-energized to make a difference.